Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks so much for tuning in, and I'm glad you're here. Today, we're going to continue on a series that I embarked on not that long ago that's geared towards men. I am under no illusions. My followers, on Instagram and on YouTube and all the other platforms are primarily women. I think Ellen, was it 98% something? Yeah, it's women, and that's I'm very thankful. And honestly, think about that. It's humbling. Picture yourself being me here, and being welcomed into that space with you. That you allow me to come into a space and speak to you about your endocrine system and about how it impacts your mental health and impacts your overall wellness. And to think about what it's like, again, from my perspective, because women have not been well treated traditionally by men. There's been a lot of gaslighting, a lot of mansplaining, and there's a lot of righteous anger on your part. And I see it in the comments. The last video we put out, there was a reel in there about doing dishes, and that struck a nerve. And I read all of those comments, and there is a lot of valid hurt. So being a man coming into the space and you allowing me into the space, because I wouldn't be here if you weren't here. But I'm thankful. I'm so incredibly thankful. So I'm making this series now as a tool to help you communicate with your partner on the things around your endocrine system and about your health that affect you, that men don't always do well with. And this came from a couple of years ago, I think it was. I did a video on how men deal with menopause. And is like the number one video I've made on YouTube, and tons of views, I guess, for me for a video. I don't have a ton of followers, but a lot of views for me. But there's a lot of comments in there with men that I just kind of avoided, because I just don't like to argue with that kind of guy's opinion. But then I realized, it's part of my job is to help communicate, regardless of people out there who will be trolls, and I realized how important this is, again, to do my best for you and walk into that space. So, the one I did last was on PMS, and about how men can play a better role at listening and being present for you. How PMS gives us an opportunity as men to understand our relationship better, and that and I'm summing it up now because I think it was such an important point, and I am circling back to it. When you have your cycle, it's a very vulnerable place. And I find that it is an important thing that the things that women discuss during their cycle, as I mentioned in the previous episode, a lot of times that's an opportunity for a man to realize, like, how am I doing in my marriage with my spouse? And I use the example of dishes because, for better or for worse, a lot of times women are conditioned not to always communicate what they're going through. It's a cultural thing. And then it is reinforced in a marriage that sometimes sticks to that pattern, the hegemony of men being in charge and women, being quiet. And that doesn't give anyone what they want. No one will thrive in that type of relationship, ever. And I know this. So the idea is that when a woman is having her cycle, a lot of times the things they've been self-silencing, not fully communicating, come out. And a lot of times they get upset because they feel like they have no self-control, those things, all that stuff. But I wanted to see it through the lens of, like, this is an opportunity for a man to say, okay, I can do better here. And I use the example of a cup on the table during PMS, where women were like, why is this cup on the table? It was it was just an example I made up, but the cup on the table. It's not the cup. There's more to it than that. It's all the things that have been happening all month long that she wasn't bringing up because she didn't feel safe to. And how it's important for us as men to give them that space and to honor and to respect them and to give them that place where we can hear them and meet them from a more balanced position. There's a harmony in marriage. There's a partnership in it, I believe. And it's not just marriage, it's all of our relationships. You know, when men enter that space with women, I just feel it's very important for us as men to navigate it a little bit better. And that's been my experience. And that's why I wrote that down, because, you know, otherwise women get pathologized for that. You know, like, this is just her period. This is just her going crazy. You know, it's not. It's more than that. So then you're thinking, Brendan, why are you recovering over your last episode? We could just watch that episode. Good question. It's because it kind of feeds into what I want to talk about now. And what I want to talk about now is going to be 2 episodes. And no matter how I try, I can't get it down to 1. And it's about fertility. Talk about putting everything in one basket and blaming one part of the partnership. You know, I'm making this video to help you women discuss this with your husbands and helping husbands understand it's from a better perspective than what we may be in already. So I'm going to go into fertility, because fertility is a mess in medicine. It's a total mess. And it's only going to get worse. I'm sad to say that to you. I am so sad to say that to you. Fertility is not going to get better. Sperm counts have dropped by 70% since the 1970s. 70%, 70%. That's not argued. That's a fact. And whatever is causing it, plastics, by the way, microplastics, environmental toxicity, has caused it, is not going away soon. It will go away. You notice that there's more and more stories about, you know, different studies being done on how to reverse this. And you know, we are getting better with it. The world is going to be okay. We're going to be okay. But there's going to be a bumpy patch with infertility for, you know, a while. I don't know how long, but we will get through it, you know. I remember when they first did the studies where they found in 2002, and it was published in Environmental Health Perspectives, which is a journal, and they talked about how anogenital distances were shifting with boys who were born in NICUs because they were so exposed to plastic. That's when we first started understanding the impact that these BPAs and phthalates were having on, you know, the male reproductive health. And more boys were being born with micropenis. And that number's only grown since then. But if you'll notice, in the early 2000s, when that journal published it, that's a great journal. Environmental Health Perspectives, a huge fan of that journal. I love that journal. But when we first started realizing that, I don't know if you remember, that's when everyone was like, BPA-free bottles. Think about it for a minute. Once we understood that there's danger in these plastics to reproduction and to these babies being born, what did we do as a people? And I just want to do a good feel-good moment right here for you, because the stuff I'm going to talk about can be very depressing. It could be feeling very, very hopeless. Do not be hopeless. Trust me in this one. Because as soon as we found out BPAs were a problem, people were pulling BPAs out, and companies like Nalgene, there were Nalgene bottles being made. Everyone was all, look into Nalgene. It was big. And you can see we have only moved forward with that, removing plastics from things, removing BPAs from things. You know, it's only going to get better. They're finding microbes now that'll eat plastics from landfills. We're finding out different ways to reduce that overall burden in the environment, so we're getting less and less microplastics. And that's a good thing for fertility, I promise. So that's down the road. What do you do now? Let me step back and talk about fertility for a moment. As a physician, when you get, you know, you get to that point where you start learning reproductive endocrinology and pathology, you'll notice that the book is dedicated to women pretty much. It's mostly women. There's 3/4 of it is going to be on women, and there's going to be maybe 1/8 on men, and then, you know, the rest is on the emotional impact of infertility. That's a standard book recipe for fertility, reproductive endocrinology. That's it. Women, a little bit of men, and then the rest is psychology, the brain how it impacts people emotionally. I love the emotional part, but what about the men part? That's not enough. It's not enough. It's all put on women. It's all been put on you. And women will come to my clinic and they are concerned about their fertility and they come in by themselves. And they want to get worked up to make sure everything's fine. And they wonder why they're not conceiving. They'll do everything within their powers to become their body be ready for it, to do all the stuff necessary, but where is their partner? And frequently find that their spouses don't always come to these appointments. It's, in women's cases, you guys carry the burden of this, and it is an emotionally trying and difficult thing. So my goal today is to give actionable material that you can use in your relationship with your spouse to help further empower you, and also to help understand the role that men play, because 50% of infertility comes from men, literally 50%, but all the medical care is primarily geared towards women. That's an imbalance. I mean, if we know the problem can be this or this equally, and all we do is focus on this, that's not smart or healthy. It also makes this party feel like the whole burden is on them when it isn't, because there's this whole side to it here, and they have no control over the side here. And there are a lot of problems with the way we approach men with reproduction. There's a lot of emotional stuff. So my goal is to do a good job to kind of help talk about this. How do we move into this space? How do we help these men understand this? Being a father is the most beautiful thing that's ever happened in my life. Let me say that. Everyone who's ever come to my life had to earn a place in me. Like, I had to get to know them, see if I like them. You know, you work your way up with a friendship, and it took time. You know, I met my wife, you know, randomly, and we just kind of got to know each other, and we fell in love. I met my best friend, you know, and it took years. You know, I liked him right away, but you over time get to know these people, and they work their way into your heart. Children, when they're born, they're in your heart instantly. They're like just deeply woven into you. And as a father, it has been one of the most rewarding things in my life. I love being a dad. It is a joyful thing. And there are so many men that want to be fathers. But there's these layers of anxieties. There's things about it that, about our own fertility that kind of make us nervous, and we tend to be avoidant with these things. So my goal today is to help you navigate that and move through it, and I want to help. So if you're a husband who's watching this, you know, I want you to know that, you know, in society and in medicine, fertility has always been placed on women, always. You'll never hear about men having fertility problems. You'll never hear about that with men. Almost never. It's always put on to being about women. And, you know, there's only so much they can do. And what's sad is that when they go into their doctor's appointments, a lot of times the doctor plays into that narrative, because many doctors are only trained to just, let's put this woman through, let's get her up on the table, let's IVF or IUI. They just push down that road. And there is a definite role that we play. Why this often gets overlooked or forgotten about is part of it is cultural, and part of it is like medicine and the way medicine works, you know, and medicine is not, your significant other can tell you this, can confirm what I'm about to say. Medicine doesn't treat women always that well. And, you know, they turn normal things that happen in their body into a pathology, or they put all the responsibility onto them for, like, especially in this case, fertility. And they always look at us. They kind of overlook us. But we are an equal part in this. The thing that keeps many of us men from going in and addressing it partly is because, you know, you'll have physicians kind of not really pulling you into those appointments. You know, so say your significant other wants to conceive, and you want to be supportive of her. Oftentimes, you're not invited to the appointments, It's just done without you. So I want to first say one of the first things you can do is step into those appointments with her and be a part of it with her, because this is also you. So if your wife is going in for fertility checks, I want you to be a part of that. That's the first thing. Be a part of it with her. Step into that space with her. That's the first piece of advice I can give. Another reason why this is kind of an issue with us is deeper. And this is something I thought a lot about how to talk to you about this over the past week. I've read so many articles on this over the course of my career, and I've seen so many men over the course of my career with this. And I never know if I do a good job with it. I'm just going to keep trying, though. Our fertility in us, for some reason or other, is strongly linked to our masculinity. If I can't have kids, I'm not really a man. Me being infertile means I am impotent, meaning I can't even have an erection. I can't even have sex. I'm not even doing it right. There's a lot of insecurity that goes into this with us, hardwired into us. And it seems that when someone wants to check our fertility, our ability to provide viable sperm, that is somehow or another challenging our masculinity at its most core. If that's you, I want you to know that's valid. That fear, you're feeling that, it's valid because it's been taught to us, and it almost seems biologic. But it's not fair to put those two together for you, because they're not the same. They're not the same. Your ability to conceive has nothing to do, your ability to provide viable sperm has nothing to do with your masculinity. And that by finding out that you don't have, or that you have a fertility issue, does not mean that you're flawed as a man. Still, it creates so much anxiety for us to talk about it. Let's dig into understanding why for a moment. Step back for a minute with me. And let's talk about how this process works of our body with generating sperm and testosterone. Our pituitary has a thermostat up here, and it's always monitoring how much you have of your hormones. In this case, let's think about testosterone. So your pituitary has that thermostat up here, and it's like measuring it, And if you don't have enough testosterone, the pituitary sends a signal down and says, make me more testosterone to your testicles. There's no thermostat for sperm count. Okay, well, there's a tiny bit, but it's a little bit. Still, let's just use testosterone. I don't want to get too narrow. Let me just stick with this one part. Sperm and testosterone is intimately linked in its production because it's relying on those signals coming from the pituitary. If your testicles are compromised and you're not generating enough testosterone like you're supposed to, which has become incredibly common, you're also probably not going to have the same amount of sperm that you're supposed to have. Your sperm count's probably going to be low also. So now, with a low sperm count and low testosterone, it's very difficult to want to address the problem. Because the thing about testosterone in us as men is it helps promote assertiveness and risk-taking and confidence. It has a big impact on our amygdala, the part of the brain associated with this, and other pathways as well, but just let's point out that way. So when a man has a low sperm count, and then we're like, okay, we should figure this out. Say there's a fertility issue in the relationship. It's like, hey, we should talk about this, figure this out. If you have low testosterone, you don't want to. The anxiety will be higher than it should be. The avoidance comes in. Because that's the other thing about this. Testosterone informs the part of our brain and primes it, is that whole fight or flight index we have. When you face a stressor in front of you, you're going to either go fight or you're going to fly. You're going to run, fight or flight. And it doesn't always mean you get out there with your fists, but it means there's the I can do this attitude of like, I can face this and I can get in there and I can, struggle with this and work on it. That's the fight. That's when you see something difficult, you're like, I'm going to do this. I'm going to apply myself to this. I'm going to push through this. And the flight is when you're like, look out, like, there's no way, I'm going to walk away. That's the flight. When you have low testosterone, you tend to go more into flight And flight would be avoidant. And flight would be like, I don't want to talk about this. We become more reactive and we become more anxious because the other thing that happens with that. So when you see us, when we have a low sperm count, and that's the cause of the infertility, we don't want to address it because our testosterone levels at these points tend to be very low, and it's difficult for us to want to face that. We find ourselves kind of withdrawing. It's important to know that that is a fixable, resolvable thing that we can get into with them. We can help them with their testosterone. We can improve that. We can help navigate that. But the first step of navigating that is in your hands. When we become avoidant and we don't step into that space with our partner and show up equally, being brave, being confident, being assertive, decisive, and it's left to her, and we abandon her, because that's what we do in the moment. We abandon our partner because we don't want to deal with it. That creates such a strain in our relationship. It creates resentment. It creates trauma in that woman. That woman that is a part of your life, your partner. That's the moment we're supposed to lean in hard and be there with her in those moments and be strong in that moment with her. When we marry and we couple with someone and we put our lives together with someone, we share these things together. And having a child is a decision we make together. And if one of us wants a child desperately and the other one does not, that should be navigated. That should have been negotiated at the very beginning. And sometimes people change it all of a sudden, like, I do want a kid. You know, that's beyond the scope of this talk right here. Okay, I'm not gonna get there. But I'm gonna say you're in that relationship where you're both going along, like that was a plan when you first got together, like you're both of the mindset someday you wanna have kids, fine. When your partner starts hitting that window of time when it's ready for her and wants to go down that road, if we become too avoidant and we leave her alone, I've seen years go by and the male partner, we waited too long because we were too avoidant. We had too much fear. And that happens. All right. I know it. It's happened to me as a man. I see it in my practice. It's just that every time, as I mentioned a moment ago, that we avoid dealing this with them, it harms them. But even more so, if we wait too long, we're going to find ourselves in a place where we've passed the window of fertility or safe fertility. And then there's so much regret that men have because they did want to have a kid, but they avoided it till it was too late because we also have a biological clock. I mean, you see these exceptional stories where, like, an 80-year-old guy conceives a kid. That's weird. That's not common. That's weird. Okay. Our sperm degrades over time. And that's my next episode. I'm going to talk a little bit about our health around this and why this is important and different things to think about. I'm going to explain to you a little bit about male factor infertility and different aspects that I want to give you some hope. But I first want to kind of point out from a caring perspective, I want this for you. That's why I told you why I love being a dad. I have a daughter and 2 sons, and man, I love being a father, even in the hard times. And I loved every moment of being a dad. I loved throwing around, wrestling with them. I loved, taking them out to the movies. I love being a dad, and I want that for you. I just do. I think it's a good thing. So this episode is geared towards that for you. Our next episode will get more into the biochemistry and different things that we look into that help you with conception, with sperm count. I'm going to give you some hope in that next episode. So the goal of the goal of my podcast is not to, the goal of the podcast, honestly, is to be helpful. That's it. That's all I'm here for. I'm here for the feels. I'm here for the work. I'm here for the impact. I'm here to do good things. I'm fortunate. I'm in a place in my life I can do that. I can have this be the thing I do because it makes my heart happy. So that's why I do it. This is not something where you're going to see me selling you something. It's not going to see something where you're going to try me, come in and see me. I'm taking patients. I'm actually trying not to. And I don't want you to think that this is a pitch, because it isn't. It's me bringing my heart to my work and speaking what I know to be good and helpful. And to the degree I do that, I did a good job. And if you like it, press like. And if you think what I'm doing is something, you'd like to know more about, follow me, And if this would help someone in your life, share it with them. Your comments are everything, and I read them all. I do. And I don't always respond to all of them because, the first 2 days out, I try and respond to everyone. But after that, I can't keep up because I have a lot of other things in my life. But please know I do read, and I try and comment as much as possible because I cherish this relationship I have with you guys. So thank you. And I will see you at the next episode. I'm going to go into male fertility again a little bit more depth. And I think that'll be helpful to give a little more hope when it comes to this. So thank you. And I'll see you at the next episode.